Hi, my name is Iliana Ruiz, and this is my final project for Essentials of Professional Fitness. I'll be going over Chapter 18, clients who are pre-adolescent, older, or pregnant. In this presentation, I'm going to review the general training principles and exercise guidelines for these three populations. It's not that they can't exercise safely, it's just that some parts of these populations may require modified workouts to reduce injury. Again, what I'll be going over is pre-adolescent youth, older adults, and pregnant women. So we'll begin with pre-adolescent youth. So for kids, one of the major issues within exercise for this population is childhood obesity. The number of children who are overweight and obese continues to increase worldwide, which in physical activities levels for young boys and girls has decreased, which makes this a major public health concern. Since the 80s, the percentage of boys and girls in the U.S. has more than overweight boys and girls in the U.S. has more than tripled, putting many kids at risk for cardiovascular diseases and other risks associated with childhood activity, such as coronary fatty streaks and type 2 diabetes. And the reason that this is important is because these diseases can lead to things like kidney failure, blindness, and limb amputation early in life, which is what we do not want for these kids. Evidence-based exercise recommendations and modifications. The difference is that youth and adults have very different needs and are active in different ways. This is why adult guidelines should not be imposed when training for children. No matter how big or strong the kid is, kids are different than adults. Kids grow differently. Their bodies are still growing and developing and changing. So no matter how big the kid is, adults and kid training should not be the same. Exercise recommendation modifications. Children, they naturally engage in short bursts of sporadic activity with brief low intensity rest, which is what we should be using. And so we're going to use things like HIIT, high intensity interval training, in types of programs that will involve quick, vigorous effort that closely mirrors the kid's natural pattern. Trainers should use this and incorporate the energy that kids do have into their youth fitness programs with small side games and fitness circuit style workouts. A safety concern that we had was resistance training for children. It was previously believed that resistance training would damage the epiphyseal plates of children and impede their statural growth. However, we know now that children can participate without safety risk as long as they do not participate without the guidance of a qualified professional or individual. It is only when the volume and intensity of training prescribed the exercises are too intense for them is that when we begin to risk injury. So while we do want to push the kids and help them grow, we don't want to give them more than they can handle and risk hurting them. So implementing resistance training for pre-adolescents, it is always better to underestimate again than overestimate their capabilities and risk them getting hurt. It is recommended to use a light to moderate weight that can be lifted for 1 to 2 sets of 8 to 12 reps to safely begin a child introductory resistance program, and you can continue building from there. So, practical application strategies for fitness professionals. Intervals, children should engage at least 60 minutes or more of moderate to vigorous physical activity, MVPA, daily. That's appropriate for their age and for their movement. Activities, so fitness professionals should engage children in structured programs like PE classes, personal training sessions, team sports, lifestyle physical activities, playground games, walking, biking from school, anything that keeps them engaged on a daily basis and keeps them from sedentary activity like, video games, iPads. Practices, regular participation in physical activity should be practiced to help children enhance their aerobic endurance, strength, flexibility, skill-related fitness. So, for example, instead of a 30-minute jog we would give to an adult, we should create a circuit of 8 to 12 stations that include bodyweight movements. So give them jumping jacks, squats, fitness ropes, medicine ball activities, include a dynamic warm-up before the activity and a static stretch after the activity. And with this, we should also add clear instructions and demonstrations because not only are we building the child's strength, we're building their self-confidence. Next, we have older adults. So in the older adult population, there's a wide variety of risk factors because of their health. So some health issues associated with aging include sarcopenia, osteopenia, obesity, diabetes, cardiovascular disease, and musculoskeletal problems. Unfortunately, the underlying cause of many of these are overlooked by both patients and physicians because of their age. One of the most prevalent risk factors for older adults is sarcopenia, which is the progressive loss of muscle that can occur rapidly in adults who do not participate in exercise. So adults without resistance training often experience 5 to 10% reduction in muscle mass every decade, accounting for about 90% of the strength decline associated with aging. This can also lead to osteopenia, reduction in bone mineral density, and this is a big concern because many older adult men and women don't realize that they can fix this and or manage this. So the difference here is that despite what many people may think, we can build back up their bone health. Several research studies have shown that resistance training for older adults have and can lead to significant increases in muscle mass, similar to seen in younger adults. On average, resistant exercises help older participants increase muscle mass by 1 pound per month, helping reduce the rate of sarcopenia associated with inactivity. So, moving on to exercise recommendations and modifications. Regular resistance training provides numerous health benefits. Studies have shown that resistance training can increase bone mineral density by 1% per year, improve their insulin response, blood sugar control, but it can also, there's strong evidence that it can also help reduce the risk of cardiovascular disease, certain cancer treatments and side effects, musculoskeletal discomfort, and enhance their mental, emotional well-being, physical function, and mitochondrial health. So a large scale of their health risks and concerns. It's recommended that they follow a regular, well-structured activity plan that includes both their strength and aerobic training. Some examples can be single and multi-joint exercises and use equipment such as free weights and so on to build their progression over time. So one of our main primary safety concerns with this age group is falling. Falling is the largest cause of injury in the older population. This must be taken into consideration when planning their physical activity. According to the AACSM, balance training should be implemented for older adults who are at risk for mobility issues. Other safety concerns include, but are not limited to, cold, flu, reduced flexibility, reduced tolerance to heat and humidity, difficulty seeing or hearing. And again, as you can see, there's a lot of ways we can combat these issues, but it's just important to consider when dealing with the older population what safety concerns they are facing. So now we have practical application strategies for fitness professionals. Warmed up and cool down should be included in each training session. Start with appropriate examples would be easy cycling and treadmill walking, just similar activities for both the warm up and the cool down. According to the 2019 NSCA position statement of resistance training for older adults, for activities, it's recommended that older men and women use multi-joint exercises that work 2 or more groups at the same time. So some examples would be squat or leg press, bench or chest press, bent over row and lat pull down, free weight machine shoulder press. Some single joint exercises recommended include leg extension, like curl, triceps extension, bicep curl, low back extension, abdominal curl. Practices. So when beginning exercise, new older individuals, essentially should initially perform only a single set of each resistant exercise because we need to see what they're able to handle. A commonly used method for progression is the 2 for 2 rule. So when a person can complete their target number of repetitions and exceed it by 2 reps for 2 consecutive workouts, then we can increase their resistance. All right, our final population is going to be pregnant women. So in general, women with uncomplicated pregnancies can continue their regular exercise to improve their physical and mental health. However, some medical conditions may pose an absolute contraindication for physical activity. And what this means is when there is a contraindication, that exercise should be avoided completely, except when cleared with a physician. And we need to be aware of this and look out for this when there's signs like vaginal bleeding, abdominal pain, regular and painful contractions, amniotic fluid leakage, dyspnea before exertion, dizziness, headache, chest pain, muscle weakness, balance, and so on, because we need to be able to catch that. So again, evidence-based exercise recommendations and modifications. Many women with uncomplicated pregnancies can safely continue their exercise following the physician's recommendations and attain maternal health benefits. According to the 2020 report from the American College of Obstetric Practice, women should be encouraged to do both aerobic and strength training exercises before, after, and during their pregnancy. Again, it's only when there's a medical complication that we need to be concerned. So, moving on to exercise recommendations and modifications. Regular exercise during pregnancy may help reduce the risk of developing pregnancy related conditions like preeclampsia, which is pregnancy induced hypertension, and like gestational diabetes mellitus, which is a form of diabetes first diagnosed in pregnancy. In the case of an uncomplicated pregnancy, it is recommended that women engage in at least 150 minutes of moderate intensity exercise each week to improve their health and reduce pregnancy risk complications. So, moving on to safety, one of our primary safety concerns is balance. During this time, both the uterus, breast, and their breasts are enlarged, which change a woman's certain center of mass. So, this can affect their balance and body control, and exercises that require balance or agility should be demonstrated with caution, especially nearing the third trimester. We don't want people to fall, we don't want people to get hurt, and if you're not fully in control of your body, that's harder to control. So women should avoid activities that carry a high risk of falling or physical activity that could result in abdominal trauma during the pregnancy. This kind of activity can pose a serious risk for the mother and the baby. All right, so practical application strategies for fitness professionals. Safe activity application. For women not currently active, it is important to steadily and safely integrate activity into a daily routine. Incorporating short bouts of walking into daily activity can be an effective and manageable way for fitness professionals to help participants begin their pregnancy exercise. So, again, if you haven't before, we're not going to just throw you into it. It's important to build the patient's strength over time. Practice with medical guidance. So some women may feel more comfortable starting exercise after their second trimester once like side effects like nausea have passed. A well-rounded exercise routine for this group should include warm-ups, cool-downs, resistance training for major muscle groups, pelvic floor exercises like Kegels, although it is best that we avoid the Valsalva maneuver to avoid pressure to the pelvic floor. Engage in 20 to 30 minutes daily of activities like walking, swimming, and group exercises are encouraged to promote their health and reduce injury risk. So, regardless of timing, it is still important that women consult their physicians before starting, modifying any kind of training program. Safety is always key for both the mother and the child. And all of our work, I used our textbook. So, all through the slides, everything's cited, but all from our one book textbook. So awesome, great. That was the end of my presentation. Thank you so much for watching, and hope you have a good one. Bye.